Hi everyone, it's Dr. Campbell and I am back with another ICD-10 CM coding guidelines review. And guys, after all of that discussion about the mom's record, we are finally in chapter 16 where we can talk about coding for the newborn. So chapter 16 is the conditions originating in the perinatal period, and it's actually certain conditions. Code family P00 through P96. All right, so to begin, for coding and reporting purposes, the perinatal period is actually defined as before birth through day 28 following the birth. All right, so now let's look at some general rules. So first up, I know you guys know this, but these codes are never used on the maternal record. Just like codes from chapter 15 are never on the newborn record, these codes are never on the maternal record. Now, chapter 16 codes may be used throughout the life of the patient if the condition is still present. So once the patient has it, if it's still present, you can code it throughout their life. When coding the birth episode of a newborn, the principal diagnosis should be Z38 category. This says essentially, hi, I'm here, live born infants, according to the place of birth and the type of delivery. So these codes are divided by cesarean delivery, born in the hospital, things like that. Now, if the newborn is transferred to another institution, a code from Z38 would not be used by the receiving hospital. And let me explain why. The baby is only born once. So that hospital where they're born, you're going to list the Z38 for the baby being born today, but then on the other record, like if they're transferred, you're going to list why, what necessitated that transfer. Codes from other chapters can be used with chapter 16 if the codes from the other chapters provide more specific detail. Also, guys, codes that are from signs and symptoms may be assigned when a definitive diagnosis has not been established. If the reason for the encounter is in fact a perinatal condition, code from this chapter should be sequenced first. Now, should a condition originate in the perinatal period and it continues throughout the life of the patient, as I mentioned before, the perinatal code should continue to be used regardless of the age of the patient. So if they have it, we still code it. Now, let's talk about birth process or community-acquired conditions. If the newborn has a condition that may be either due to birth process or community-acquired, and the documentation does not indicate which one it is, the default code is the birth process, and then you're going to use a code from chapter 16. If the condition, however, is community-acquired, a code from chapter 16 would not be assigned. Let's say that again. If it's due to the birth process, you're going to use a code from chapter 16. If it is a community-acquired condition, a code from chapter 16 should not be used. All right, last up on general perinatal rules, looking at coding all clinically significant conditions. Any clinically significant condition that's notated on the routine newborn examination should be coded. A condition is clinically significant if it requires clinical evaluation, therapeutic treatment, diagnostic procedures, extended length of stay, increased nursing care or monitoring, and has implication for future health care needs. Notice that. Implication for future health care needs. Okay, next up, observation and evaluation of newborns for suspected conditions not found. Very important. Evaluation and evaluation of newborns for suspected conditions not found. First up, Z05 codes. These are for observation and observation. This is used for those situations where a healthy newborn is evaluated for a condition that they wind up not having. We don't use this code when the patient has identified signs and symptoms of a suspected problem, okay? So do not use a code from this category when the patient has signs and symptoms of a suspected condition. In those situations, guys, you code the actual signs and symptoms. A code from Z80 or Z05 can be used as a principal or first listed code on readmissions or encounters when the code from Z38, that's that hi, I'm here code, no longer applies. Remember, Z38 is that first year or first day of birth, okay? Anything after that, guys, you need to have a code that specifies the reason that the care is being provided today. Codes from category Z05 are only for healthy newborn and infants for which no condition after study is found to be present. Z05 on the birth record, it can be used as a secondary code on the birth record after Z38. Remember Z38, you'll remember this. This is the hi, I'm here code. All right, next up, additional perinatal diagnoses. So if you have conditions that require treatment or further investigation or prolong the length of stay, require more resources, guys, you can code those. Codes that have future implications for future needs, guys, you can code those. Now, this guideline does not apply to adult patients, but we're talking about perinatal during those time periods when the conditions require additional treatment or the conditions have implication for future needs. All right, next up, prematurity and fetal growth retardation. So one thing you want to know is that providers utilize different criteria in determining prematurity. A code for prematurity should not be assigned unless it is documented by the provider. Of note, assignment in codes category P05, which is disorders of the newborn related to slow fetal growth or fetal malnutrition, and P07, disorders of the newborn related to short gestation and low birth weight, not elsewhere classified, should be based on the recorded birth weight and estimated gestational age. Has to be documented. In those situations when you have birth weight and gestational age, two codes from category P07, take a look at that category, should be assigned with the birth weight being sequenced before the age. The birth weight being sequenced before the age. Next up, we have low birth weight and immaturity status, which is category P07. These are for use for a child, watch this guys, a child or adult who was premature or had a low birth weight as a newborn, and that condition is affecting the patient's current health status. Next up, bacterial sepsis of a newborn. Guys, we have code P36 for sepsis of a newborn, and this code actually includes congenital sepsis. So if the perinate is documented as having sepsis without any documentation of a congenital or acquired situation, the default is, I know you're probably thinking, congenital, and you are correct, and a code P36 should be assigned. If the P36 code that you select includes the causal organism, You would not assign a code from B95 or B96. Why, guys? If the code already includes the organism, Streptococcus, Enterococcus, Staphylococcus, you don't need another code on top of that. However, if the P36 code does not include the organism, then of course you want to use an additional code to identify the organism. Also, if baby has severe sepsis, you know what that means. Yes, R65.2 and a code for the acute organ dysfunction. Lastly, stillbirth, code P95. This is only for use in institutions that maintain separate records for stillbirths. No other codes are to be used with P95, and guys, P95 should not go on the mother's record. All right, guys, this has been your Chapter 16 ICD-10 CM Coding Guidelines review. And next up, guys, we have Chapter 17, which is congenital malformation, deformation, and chromosomal abnormalities. Happy coding, guys.